Brilliant. Okay, we're going to make a start. So, Assalamu alaikum, everyone. Nice to host you this evening and spare your evening for hopefully some preparation for Ramadan, which is, of course, coming very soon, inshallah. Today, we'll be talking about how to have a healthy Ramadan. So, in terms of what we're hoping to cover today, first of all, why a healthy Ramadan? How we can best prepare to get the success this Ramadan. Things we can do to think healthily, improve the way we eat, and improve our eating habits. And also, we'll be looking to cover aspects of health conditions today. Just a bit of housekeeping. This is obviously a Zoom. You have the function of the chat box. We have one or two volunteers who will be on that to answer your questions, and we'll also have a section for questions. This talk is brought to you by the British Islamic Display. Of course, there will be some talk about health conditions, but general for general advice. And if you have please use doctors for specific advice. So British Islamic Medical Association has been running for a number of years. They are a national organisation full of healthcare people, from pharmacists, doctors, nurses, dietitians, running face-to-face and online events for the benefit of the community, with the overall aim of to unite, inspire and serve the Muslims and Muslim patients, importantly. I myself am representing Young Thinkers Gloucester, so many of you will be local from the Gloucester area. I and some family members co-founded this organisation back in 2019 with the main aims to provide free health and education events, and we've done many things like CPR, university applications, and also, of course, our weekly study club on Saturdays at the Friendship Cafe. We'll be providing details about how to get in touch with us if you have any questions at the end. So we're going to go straight on, really, about the importance of health in Ramadan. It's a concept which probably is talked about less, and it's really good that BEMA is trying to talk about this more this year. Of course, up and down the country, masjids, it very importantly will be talking about the importance of the spiritual aspect of Ramadan. That is the first priority. I don't take from that. But certainly health is something we should start to think about as well, as we are seeing in our communities. Unfortunately, especially since COVID, we're seeing that health outcomes do adversely and poorly affect our Muslim communities. We have sort of stronger risk factors for certain conditions like diabetes and heart disease, high blood pressure, and it's a time for us to reflect. It's that point in the year from a spiritual perspective, but certainly it's an opportunity for us to think about our health as well. And I think perhaps those of us with elderly relatives or people who are unfortunately unwell might see them and they are unable to fast, and they really do feel the value of health in those moments. So while we have good health, alhamdulillah, we should think about how we can protect our health and continue fasting in the long term. It's all about abstention and stopping certain things, really, isn't it? We stop eating and drinking. We try and focus on good deeds and avoid bad deeds. So we can think about that in other ways, from the perspective of cutting vices and things we shouldn't be doing. You know, smoking is actually quite an issue even in our own communities, in the Muslim communities. Of course, you know, the fried foods and the chocolates and things. So it's an opportunity, because of Ramadan, we're already in the right mindset to start cutting out things and in just giving our soul all the nourishment, that we can start thinking about physical nourishment as well. And as I say, in our communities, we do have various health problems, elderly relatives, or even younger people who are on medications, and that can be confusing. I, by background, am a GP registrar, so I know how hard it is to get a GP appointment nowadays, and that's really challenging in the current climate. And we have many questions and different concerns and things like that we would like to discuss. So hopefully this talk will start to get you thinking about how to have that healthy Ramadan and also control your health conditions in a productive way, so you actually come out of Ramadan, inshallah, feeling stronger. So why do we fast? Of course, the paramount reason is it's an act of worship, and it's a chance for us to gain taqwa and God consciousness. This is, by far the most important thing, and that's something that we should focus on. But at the same time, there's an opportunity, as I say, for secondary benefits of Ramadan, and that's the health benefits that we'll be talking about in this next 25 minutes or so. So things like weight management, cholesterol, blood pressure, a lot of the unhealthy habits we talked about, and actually even things like your mental health, which is an important part of our health. And we know the spiritual balance of Ramadan might actually give us an opportunity to improve our mental health as well. So, I don't need to go into the detail in terms of this side of things, but really, the scientific evidence of fasting is very much a very popular topic over the last 5 to 10 years. Intermittent fasting is certainly very popular, even in non-religious groups. And we know from the prophetic sunnah, the Prophet ﷺ used to fast on Mondays and Thursdays and other days as well outside of Ramadan. But Ramadan itself and the concept of fasting, it's got, undoubtable health benefits if done correctly and in an appropriate, healthy way. And we know from studies it can improve, your balance of blood sugars, cholesterol levels, weight management, blood pressure, all of these things, your immune system. And there's overwhelming scientific evidence to the benefits of fasting. And that's why you're seeing it so popular with these 5-2 diets, micro fasting, and all these other things. So it's an opportunity, and that's really what I want you to think about, that Ramadan is certainly a spiritual time, but can we be thinking about our health in a more productive way? And key to that is, of course, planning, just in the same way that we might plan our religious goals, to gain taqwa, do all the good deeds, charity, increase our reading of the Quran, improve our dhikr. All of these things are of course vital to having a successful Ramadan. You need to do the religious aspects, but certainly it's a chance for us also to think about how we can improve our health, maybe cutting down on these unhealthy habits, looking at physical activity in a healthy way, and we'll talk about that, and weight management, which we'll certainly be talking about. So planning is key to this. So correcting our intentions, as our religion tells us, this is an act of worship, but also I'd like to use this Ramadan from a religious perspective, certainly, but also can I benefit my health for the long term? So you need to think healthy this Ramadan. That's the way we're going to approach it. Small changes are things that are going to make the big difference. Okay, we're not looking for radical change, and the concepts I will talk about will be, lots of different information, and it can be overwhelming. But what I really would like you to focus on, I suppose, is just thinking about small differences you can make. 1 or 2 things. Maybe you can take away something like, I want to cut down this unhealthy habit this Ramadan, or I want to improve this aspect of my diet or my sleep or my physical activity. The small changes or what will inshallah benefit you, because of course Ramadan is around for a month or so, but then actually we want this to be a long-term success, so then we can measure next Ramadan we're actually healthier and more able to fast in a strong way, and think about those kind of things. When we think about preparing and planning, some things are in our control, of course, and some things really, they're not. That's a reality. Life routine certainly will be limited by things like your work schedules. Maybe you're working the 9 to 5, or you're working long shifts, unusual patterns, night shifts, working on weekends, you don't get much rest, and kids, sleep aspects of that. Those kind of things can't really be in your control, but can you plan around it, and can you make yourself ready for those things? Your sleep we'll be talking about as well, and certainly the diet and the health conditions, all these things, can we plan in these particular areas? What we do on a daily basis in this Ramadan, inshallah, will benefit us beyond that. So if we start forming those good habits, both from a religious perspective and the health perspective, then we can continue that after Ramadan. And that's the way to think about this. This isn't a short-term fix. And I'm really trying to draw upon, of course, the prophetic sunnah, where our, Prophet ﷺ says, Do good deeds properly, sincerely, and moderately, and know that your deeds will not make you enter paradise, and that the most beloved deed to Allah is the most regular and constant, even if it were little. So I want you to think about that through this talk and beyond, that what will you change? What's going to be the most regular and constant act that you can do from this talk, from a health perspective, even if it's just one or two small things, what's going to be achievable for you from a small and consistent perspective? Think about your previous Ramadans. What went well from a health perspective? What was difficult? Was it the sleep? Was it the sugar craving? Was it the iftars were too heavy? Those kind of things. Try and draw upon that. In some ways, with the health conditions aspect, life is always changing, and perhaps since previous Ramadan, unfortunately, you have a new health diagnosis, or maybe you've had medication changes and you need to think about things differently now, or you might need further advice about your health conditions. Set your targets. When you think about religious targets, there's good ways to plan that. And certainly for the health as well, you can set specific targets about what I would like for this Ramadan in terms of my weight, or my eating habits, or my sleeping habits. I would really recommend, from the religious aspects, we have such an abundance of resources in Gloucester, mashallah. I would really recommend Maulana Abdullah's Ramadan planner. We'll be linking all the resources at the end of this talk. It's a really good way to structure your day, work out if you're making sure you're reading the Quran sufficiently, and reading your Fard namaz, all these things. And we can plan all these things for our health as well. So we're going to start just by talking about sleep, a really undervalued aspect of our health. Really, what we should start thinking about from a sleep perspective this Ramadan is the quality. Okay, more about the quality and not the quantity. I think often we think about quantity, number of hours, trying to get enough sleep in, but actually quite a few of these things might be out of our control, as I was saying, with work, with the nature of iftar. Obviously, it's a little bit easier this year compared to the summer months, but then Tarawih late at night, and then obviously Sari as well. We're limited how much we can control the hours of sleep, especially if we're working. But can we improve the quality? And we know there's good data now to suggest that there are things practically we can do. So certainly trying to stay consistent with your schedule has been shown to improve the quality. That's even outside of Ramadan. For example, if you have that Monday to Friday 9 to 5 job, you're waking up 7 o'clock in the morning, and then on the weekend you decide to really wake up 10, 11 a.m. They call it the social hangover, having a lie-in. It can actually affect your sleep quality negatively, and it's much better to have a consistent routine, going to bed at the same time and waking up at the same time. Those things have been shown to be more helpful for you. Certainly other things that could be useful this Ramadan, and quite easy to link with your religious aspects, cutting down on the phone use before bed. We know the blue light stimulates the brain quite highly before bed, and even if 15 minutes is quite a conservative target. If you could aim for even half an hour before bed, I'm not going to be using my phone. I'll actually do something like read the Quran, or do some dhikr. That could really be beneficial for the quality of your sleep. Spiritually, it'll be calming you, and actually you'll be off the blue light. Avoid sort of louder environments, too much lighting, those kind of aspects. Try and dim the lights before bed and improve that side of things. Really, we're all probably to some extent caffeine addicts. I'm probably just as much a culprit. Is there a way this Ramadan that we can reduce our caffeine? I think there really is, because you have limitations in when you can drink the caffeine, and certainly the nature of the fast means that we won't be able to have as much caffeine, and this is an opportunity for you. So you can cut down the amount of caffeine you're having, even if it's just the 1 cup between iftar and sahur or sari. It will improve your quality of sleep. We know that caffeine remains in the system for roughly around 12 hours. So even if you had sort of a drink on the outside of Ramadan around midday, you might still be experiencing caffeine in the bloodstream 12 hours later. So really, it is something that will negatively impact your sleep. To some extent, it's good for the health. So I'm not someone who's going to be completely anti-caffeine, but using it as an opportunity to try and cut it down is a good chance. So that's sleep side of things. can we try and improve the quality of our sleep? Let's focus on quality rather than the quantity. Okay. Physical activity, I know there's going to be a range of backgrounds when it comes to physical activity. Mashallah, we have younger people on this call, as well as some of our more elderly relatives and friends, and there's different expectations. I'm sort of talking more from the perspective of minimum levels. Okay, walking is real exercise. I've put that there, and actually, it's again something from the prophetic sunnah to walk with a sort of power walk, or with a pace to your stride. It's really good for the health, and actually, it's something we can continue during Ramadan. The sort of ideal timings might sort of so ideal timings for light exercise, particularly our more elderly audience members, are when you're actually hydrated. So either after iftar or just immediately prior to iftar are probably the preferable times, because you shouldn't really risk dehydration. The length of the fast is still fairly long. For those of us who are young, and or some of us who are particularly active, there is very good guidelines on this. We'll link the resource to Aspetar. This is a sports institute in Qatar, who are linked with the football club PSG. Generally speaking, they advise for again pre-iftar, or sort of around 3 hours post-iftar for optimum exercise times. If you're a gym goer or someone who likes to do more strenuous exercise, the advice is, generally speaking, to try and keep physically active. Okay, so don't use Ramadan as a reason to not be active. Try and keep up some level of physical activity. And as I say, for the purposes of this talk, I think walking, is a good way of just trying to keep things moving. Okay. So we've spoken about some of the things we need to think about, particularly sleep and movement, but really the focus of the talk is more about how we can think about our eating habits. In the Quran, in Surah Nahl, it says, "So eat of lawful and good food which Allah has provided for you, and be grateful for the favor of Allah." And I think, obviously, we're very fortunate in today's society. We have such access to food like no other society before. And that can come with issues, of course, because it means we're probably overeating, or really over snacking. And so Ramadan is a good time to try and cleanse some of these unhealthy habits. Just as we say from a religious perspective, we should try and cleanse the soul, purify the heart. We can do these things with our diet, and we can do these things with our physical health. What are your weight goals? I mean, for all of us, as a standard, it really should be, we should try and avoid weight gain. I'm not referring to maybe some of our gymming friends who might be looking to bulk up this season. I'm saying, as a general gist of things, try and avoid weight gain. That should be one of our goals. Certainly, if we are overweight or have type 2 diabetes, it's a good opportunity to actually lose some weight. And we know that we can do this in a safe way. And this will give us better blood sugar control, and also reduce our risk of getting diabetes. And probably something safe is around about half a kg to a kg per week. Okay. We're going to go into the very specific detail about how we might do that with specific targets. Before we go on to that, we're just going to run through some of the unhealthy things, which I think we're probably all, in some way, we can associate with these things. I certainly can, unfortunately. But what kind of things are probably unhealthy that we can think about reducing in our Ramadan this time in terms of our food habits? Certainly, portion control. It's a vital thing. I mean, and our eyes become bigger than our stomachs when it comes around to iftar, and we probably are overdoing it really in terms of our needs, and this can really cause a high blood sugar spike and actually make you feel tired and lethargic, which isn't really ideal for the tarawih that we want to then read. It's all about portion control. We're going to talk about the portion sizes that we should try and focus on, but really trying to be responsible in our eating habits and not get overexcited with the sort of the attractiveness of a big iftar. Again, similarly, I suppose the highly processed things we should try and look to avoid, really. And certainly if we're consuming lots of that already, then even reducing it will have a really good impact. So things like the sugary foods, the fizzy drinks, cakes and sweets, even the children's cereals, unfortunately, the Kellogg's and things like that, they can be quite highly processed and unhealthy with the amount of sugar they're really packing in, and it's not really bringing you any nutritional benefit. Things like the desserts, which are loaded in sugar, it really shouldn't be a daily habit for us. This isn't, from a spiritual perspective, the meaning of Ramadan, and it's actually, going to just keep on spiking the sugar. I'm not being ruthless. Absolutely, there's the treat days, and we all have to welcome those kind of days as well. But making it too much of a regular habit will only hurt us in the long run. Some people might find it difficult with snacking in between the iftar period and sahur or sahur period, particularly if they're staying awake or the nature of their job means they're working overnight. Trying to avoid that because it's causing a persistent high sugar all through the night, and that's not healthy for us. Fast eating. So again, it comes back to that excitement, that indulgence, that iftar time, trying to just slow it down, and actually you'll realize that you feel fuller quite quickly. Whereas if you're eating quickly, you'll consume a lot more. Things like people perhaps sometimes trying to skip sahur or sehri and maybe wake up or not avoid waking up early. That prolongs the fast unnecessarily, and Allah has tried to create things which avoid excess hardship. So we don't need to create hardship for ourselves. Where you're prolonging the fast, you're prolonging dehydration, you're prolonging chances of low sugar levels. So eating at the appropriate time for sehri rather than sort of waking up too late is much more sensible. It's good in sehri time or sahur time to try and vary things as well. We certainly will be advising actually to have low glycemic index food. So those are things which are more complex for your body to break down. They last longer. Good examples are like things like oats, porridge, barley, sweet potato, those kind of things. They'll keep your blood sugars steady through time, rather than having just fast sugary foods, chocolates, or cereals, fizzy drinks, juices. They'll give your body an instant sugar high, but actually won't keep you sustained through the day. So trying to vary your sehri or sahur will be much more beneficial for you. Avoid the fried foods, guys. I'm as big a fan as you are, but if you could try and reduce it and focus on healthy fats, it'll be much better for your cholesterol levels, your risk of heart disease. We've touched on daily activity and sleep, so don't use this Ramadan as an excuse to become really lethargic and not do any exercise. Do some light walking. It's very reasonable to do some light walking, and try and keep your sleep quality as best you can. I'm using this quote now from a book called Atomic Habits, and I think this is really important to take away again from this talk today. It's so easy to overestimate the importance of one defining moment and underestimate the value of making small improvements on a daily basis. Too often we convince ourselves that massive success requires massive action, and that can be demoralizing because we think we need to do something really impressive this Ramadan. We're going to, and we do this religiously as well. We think we're going to, do as many Quran khatams as possible. And then when it doesn't, finish quickly in the couple of days, we get demoralized, then we just give up. Keep your small successes at the forefront. Just as the prophetic sunnah, back to that hadith we mentioned at the start, small consistent actions are really what we want to try and aim for, and try and keep things steadily going. So then after Ramadan, we continue those good acts, good healthy acts as well. Broadly speaking, in terms of food groups, certainly salty foods, not only will they be significant for dehydration, they do increase your risk of things like blood pressure and heart disease, and 6 grams or less is generally the recommendation. So trying to cut down those sides of things. Processed foods will always have more salty aspects to them. Fat, it's something where we need to try and incorporate the healthier fats, switching to things like olive oil and avoiding the unhealthy oil, trying to incorporate maybe avocado and other kinds of healthy fats. Nuts are much better for us rather than the deep fried foods. Sugar we'll obviously touch on again when it comes to diabetes, but just as I was saying, try and incorporate more complex carbohydrates, which take more time for your body to break down. They'll keep your body sustained through the day rather than an instant hit, okay? And certainly we probably underestimate the harm that things like juices and fizzy drinks can really do. Quick sugar hits, but actually not very healthy because it'll spike your sugar without the nutritional benefit of fiber, like just eating a piece of fruit would actually give you the fiber as well, whereas juice doesn't even have that. See if you can find ways of varying your diet rather than having too much meat, particularly red meat, which has links to things like bowel cancer. Of course, it's still an important part of the diet, it has a good source of iron, but trying to vary things, having fish or having days without meat. We can draw upon the NHS advice about what a plate should look like. This is still very sensible for Ramadan. A good amount of vegetables, as you can see, it's pretty much half the plate, whereas the carbohydrates, the meat and things, the protein is just a smaller portion of that. This is where, in this part of the talk, where we're delving deeper. This is guidance from the International Diabetes Federation, as well as the DAR Alliance from Qatar. They have really good advice, not just for diabetes. And I think this plate image is quite useful. It's an iftar plate rather than just the standard NHS plate. You have your cup of vegetables, but you still have, aspects of good source of protein, some complex carbohydrates, and still some healthy fat with the olive oil. And of course, something like a fruit as well, which has still got some nourishment with the vitamins, minerals, and hydration as well. Their target recommendations, particularly when it comes to things like weight maintenance, are listed. So for men, it might be around sort of 1,800 to 2,200 calories. It does vary for women depending on your size, but certainly there's different targets around 1,500 if you're looking to lose weight this Ramadan. And if you're slightly shorter and the women trying to lose weight, around 1,200 calories. And the proportions, we can probably say around 30 to 40% of that should come from your sehri, whereas 40 to 50% should come from your iftar. So the balance should probably be skewed just slightly more to iftar than towards sehri. And there is room there for a healthy snack as well. We have even such good resources to the extent just an example here of what a day could look like, depending on your preferred country of origin diet. With your different weight targets. I mean, as a Pakistani, I'm still getting a good deal there. You're getting, a hearty omelette and roti, some fruit in the morning. And then, of course, for iftar, still aspects of chicken roast and vegetable curry and other such things. They have very good breakdown detail. And actually, this is something you can all access. Okay, so we'll be providing this link. It's free. The DAR Alliance, they have something called the RNP, or the Ramadan Nutrition Plan. So for those of us who want to be very specific with our targets, remember at the start I said it can be overwhelming, so don't worry if this isn't for you, but the Ramadan Nutrition Plan, sign up for free, enter in your height and weight, work out your BMI, maybe enter your targets. Are you looking to maintain your weight? Are you looking to actually reduce your weight? What kind of country, type of origin of food would you like? Is it more the Middle Eastern? Is it more the Oriental, Chinese, Malaysian, or is it actually just Pakistani, Indian? And they'll give you really specific guidance, as you can see, really specific. So they really break it down to your iftar meals can actually look like this, with roti, dal, gives you the calories amount, the aspects of the lean protein, from the chicken. And of course, as I keep mentioning in that Eat Well plate, a significant proportion of healthy vegetables, which will really be important for our fiber intake. And they really do break it down, as you can see, something more Egyptian for you if you're looking for a different type of cuisine. And again, it's suited to your calorie targets, which will be calculated as well. Similarly with sehri, we might have something with a healthy kind of sort of cereal, which is got incorporated with it some healthy fats from nuts and fruit, and some carbohydrates as well. And we just have a couple of other examples there from a more Middle Eastern type diet. The diet can really be something that we improve from a perspective of, actually, let's just think about the unhealthy habits we're doing. Remember those top 10, can we reduce those? And it can also be something, a positive, active decision. And that's some of the things we've touched on about trying to get the right balance on your plate, high proportion of vegetables, complex carbohydrates to keep you going, and some aspects of lean protein and healthy fat. That's a really important balance. The last section of this talk, which we'll be talking on, is just health conditions, and it might be extremely relevant to some of us who maybe are worried about our health conditions this Ramadan, and for others it might be something just to be aware of with family members or friends who have health conditions, particularly some of our younger members of the audience. I would signpost to the British Islamic Medical Association Ramadan Compendium, which is a really helpful guide, but also has a risk scoring system for people, particularly those of us who are perhaps too unwell and really have a very valid medical exemption from fasting. And that's something very important that we should think about. And it also has advice for those of us who actually have a health condition, but quite well controlled and can fast with just some certain precautions. So that'll be a useful resource for anyone worried about their health conditions this Ramadan. Common things that can really occur for any of us, I suppose. Any acute illness, any sudden illness, vomiting, fevers, things which make you very unwell, it's a perfectly valid medical exemption, and those are reasons to break the fast. Things which are more trivial and things we can maybe cope with or find ways to reduce are things listed here. So heartburn, reflux, quite common, particularly after iftar. Ways we can think about reducing it, certainly reducing the sort of fried fatty foods, caffeine intake, fizzy drinks, eating too quickly, trying to stay upright for at least half an hour rather than going to sleep immediately. Those things are very common. It's also perfectly reasonable to take some over-the-counter Gaviscon or Reni. If you're really getting bothered by it, I would, always speak to your GP if it's really becoming a significant issue. But there's certainly a lot of simple things you can do before that point. Headaches are more complicated and they're multifactorial, lots of different reasons, but certainly optimizing or getting things like your sleep, caffeine control, tiredness under control is important. We know that actually when we start Ramadan, it's fairly common to actually get headaches, tiredness, and fatigue. That's reasonable. It's expected. There's not always a fix for that, other than just getting, especially milder headaches and things, just getting more used to the fast and your body's adjusting. So that's a normal thing, not to be too panicked about. Constipation is fairly common as well, and things we can do for that. Getting really good hydration, which is obviously the next point, avoiding dehydration, getting really good amounts of water, fluid, as well as increasing our fiber intake through healthy vegetables. And then if you are struggling beyond that, simple things you can do is increase some things like some flaxseed or psyllium husk, or in Urdu terms, you might call it isabgol, just to add on to your diet, just to kind of increase that fiber. And if it's really bothering you, you can try something like a senna, just to get things moving. But I would be more careful about other laxatives, such as lactulose, which can actually have a dehydration effect. And if it's getting to that point, it's more worth speaking to a member of your GP surgery. But certainly, again, lots of simple things you can really do to get things moving, to try and prevent that. Hay fever season, we're sort of approaching. Make sure you take your precautions, take your morning antihistamine, take a nasal spray. Majority of schools probably advise that a nasal spray would probably invalidate your fast, so taking it in the morning is sensible. In the Sehri time, and then if you need a nighttime iftar antihistamine of a different type, such as a Piriton in the morning or a cetirizine at night, is probably a good way of dealing with it. For more specific conditions, I would say for those of you who unfortunately have had a recent diagnosis or newly started on medications, this is very important to discuss with your respective clinicians, because if it's something you've never dealt with before, or you've newly started on serious medications like insulin or like other heart medications, discuss it with the relevant doctor who's looking after that condition if possible. If not, then your GP. Are there certain precautions? For those of you who are more well controlled and have been dealing with your health condition for a number of years, you might not need to do that, and it might be a bit more straightforward. We can touch on that. And in fact, as mentioned, or as promised, we're just going to wrap up things with a discussion about diabetes. The reason I've focused on this one, well, globally it's an increasing disease, but actually disproportionately affecting Muslims, and that's unfortunate in our communities. We're all aware of it and probably maybe a bit dismissive of it because it's so normal. But we know there's probably around 463 million people worldwide who have it, and that's almost going to double in the next 20 or 30 years. So it's a serious disease and something we should be aware about for ourselves, for our family members who already have it, and ways to prevent it with some of our healthy dietary habits. Again, I refer back to the British Islamic Medical Association. So for those of you with diabetes, there's very valid exemptions, medically speaking, where it becomes unsafe for you to fast. And particularly if in the last few months you've had a hospital admission because of diabetes, either going very, very low sugar, or very, very high, and a recent hospital admission, is certainly not advisable to fast. Things like dialysis or pregnancy with diabetes, those are also things which would medically be unsafe for you to fast. Where it becomes more complicated is if you actually just have generally well-controlled diabetes, it's very reasonable for you to fast as long as your other conditions and things aren't complicated. We should be aware of diabetes and the risks of fasting. We have to be open to that. For our family members, for those of us with diabetes, it's absolutely fine to be aware of it. There are risks of fasting if you have diabetes. So low sugar and high sugar, the signs of which are certainly things like jitteriness, trembling, any sort of fluttery palpitations in the chest, significant headache, sweatiness, or feeling clammy. That can be a sign of low sugar, and I'm sure many of you who have diabetes might well have a blood sugar checker. And the International Diabetes Federation, as many others, would recommend under 4 is a valid reason to break the fast, because it can become an emergency and it's something to be taken seriously. Just as low sugar can be an emergency, they recommend blood levels above 16.6 or also become an emergency. And signs of that can be things like nausea and vomiting, tummy pain, feeling excessively tired, or having to pass urine very frequently. These are all valid reasons to break fast. Be aware of it for yourselves if you have diabetes, or for your family members. They release brilliant guidance on the medications, and if any of you do have sort of further questions about this, we'll provide links to resources. Metformin, I'm sure many of your family members or yourselves are on this if you have diabetes, and it's reasonably straightforward. Once a day and twice a day, you don't really need to change anything. If you're on it 3 times a day, that lunchtime or afternoon dose just gets merged with your iftar dose. Okay, and if you're on the prolonged release, take it at iftar. Some of the other medications just to be aware of, I'll just rattle through these. Again, if you have serious concerns, then do speak with your clinicians about this, but generally speaking, they're mostly safe. Okay, so newly people might be on liraglutide. As long as that has been started at least a month or so before, then generally safe without any changes. Sitagliptin similarly, and pioglitazone is the same. Quite a few of you with or people who are on dapagliflozones or medications for the heart and diabetes, they don't need to make any changes either. Where things do get more complicated, and I would strongly recommend speaking to your diabetic nurse or doctor, or insulin and gliclazide. There is advice for these things, and there are recommendations, and we can provide you with those resources to talk about that with your diabetic nurse. Generally speaking, gliclazide is still very safe to take. It's just more so that if you're taking it once a day, take it at the iftar time, and if you're taking it twice a day, probably need to maybe think about reducing your morning dose. Insulin is something which I know a lot of people do fast with. It doesn't invalidate the fast. There's a good consensus on that. It's something which is important to be in mind. With both gliclazide and insulin, they can lower your blood sugar. Just as we were saying, it can be a risk, so it's always important to think about that. The main thing is to discuss with your clinician, your diabetic nurse. There is very good guidelines on this about reducing your dosing slightly, and also just monitoring your blood sugars regularly if you're an insulin user. And we have a slide just at the end for a picture if anyone wants, which is the good timings to check your insulin. I'm sure many of you will have questions, because I know that you sent it on the sign-up link, so we'll try and touch on that in the Q&A for those of you who have more specific questions. But for the general audience, that's a wrap-up on health conditions. And that's pretty much the sort of, I think we're probably just in that half an hour slot. We're wrapping up. why have a healthy Ramadan? Well, this is an opportunity, and we can really nourish ourselves spiritually from all the religious good that we'll have in this month, but actually make some positive change to improve our health beyond this Ramadan, inshallah, and prepare with planning, think healthy, eat healthy, keep moving, control your health conditions. I'll leave you with this thought before Q&A. 1% changes are what matters here. Okay, so that 1% of I'm going to cut fizzy drinks this Ramadan, or I'm going to improve my sleep quality this Ramadan, or I'm going to make sure half my plate this Ramadan every time is vegetables. That 1% is what will pay off if you do that now, next year, and the years after, inshallah. Whereas not making those changes or actually leaving the unhealthy habits, 1% each time will keep on declining, unfortunately. So we really need to make the changes now. It's a good time. Please do feedback and use our link, tinyurl.com/healthy-review. And we really appreciate your feedback for our future talks and webinars. I'm now going to open the floor for questions, which you have the option of either using the chat box, please enter in through there, or also you can raise your hand using the Zoom function and then ask any questions on there. We also have some questions from the sign up link, which we'll be using as well. So the floor is for questions. Thank you very much for listening. Yes, so we'll be able to provide resources. So just a question there regarding sharing the slides and resources. We'll give a resource pack. Okay, so that'll be all done through email. If you didn't manage to sign up beforehand but would like the resource pack, if you use the original sign up link, you can do so through there. So that's absolutely fine. We'll share that. From the sign up link, we've got a message about type 2 diabetes on insulin and what are current recommendations. So we have some guidance from the International Diabetes Federation, which BIMA, British Islamic Medical Association, verified. Main things, I suppose, you should discuss, I would recommend discussing, especially if it's your first time fasting with insulin, discussing that with your diabetic nurse or your whoever looks after your diabetes, if it's the GP. There's recommendation about when to check. So in people with very well controlled, it might just be a 2-point check, so morning and nighttime. But in people who are still new to things, they can use these 7 points to check their blood sugars pre-dawn, so pre-sahur, morning, midday, mid-afternoon, iftar time, 2 hours iftar, and any times of the emergencies, which we've already talked about. Just lots of guidelines in that sense that we can provide. Another question just from the audience about, will the material be available to check again? Yeah, it'll come in the resource pack. So if you've signed up via our, with your email, you'll receive a resource pack. If you haven't, then that's absolutely fine. Just use the original sign up link and we can email you the resource pack of slides and also the insulin information, diabetes information, things like that. But just some general guidelines about those kind of things we can provide, certainly. How to balance diet. Again, this is from the sign-up links. Taking tablets twice a day. So it's, generally speaking, majority of medications, well, a huge portion of medications are safe to take in the Sehri and Iftar periods. As you saw with some of the diabetic medications that we mentioned specifically, such as metformin, where you're taking a lunchtime dose normally, that can be merged with Iftar. I would be more, if you're worried about medications which you're normally taking at lunchtime, I would run it by your relevant GP or specialist, in the sense that most of the time it's probably okay to merge with Iftar, but probably safer just to check, especially if it's your first time. RNP, how to get more information. So the Ramadan nutrition plan is from Dar Alliance. We'll post a link to this in the resource pack. once you get to the website, it'll ask very simple details, your height and weight, and then you can enter in a couple of your details like your goals and what diet you'd like, and that's a really one to recommend, I would say. So it'll come in the resource pack with a link on how to find out more. Okay, good. Lovely. And I'll just take you back to the slide for feedback. I think questions are pretty much wrapping up, and we'll try and close it there. Thank you very much for coming, Jazakallah Khair. We hope you found benefit, and inshallah that your Ramadan is very rewarding from the spiritual sense, and you gain closeness to everything in terms of the Quran, in terms of closeness to Allah and the Prophet ﷺ. And inshallah, you use this Ramadan and I use this Ramadan to also benefit from a health perspective and increase ourselves in terms of that side of things. A question there from the audience as well, just before wrapping up. Is there any info on breastfeeding in Ramadan? Yes. So British Islamic Medical Association in the Ramadan compendium has a section. So they have a huge section on all the different health conditions, but pregnancy and breastfeeding is also in there. I'll post a link to it in the resource pack. So I'll just type there as well if you do want to Google, for anyone who hasn't signed up, Ramadan compendium. And I would you'd be able to find the resources just about advice for that as well. Okay, thank you very much for listening, and we hope you've enjoyed this talk. Please do keep in touch with us via our Facebook and Instagram pages, Young Thinkers Gloucester, as well as British IMA or BIMA. Assalamu alaikum, everyone, and inshallah you have a very rewarding Ramadan.